Hello there guys, welcome back to another anatomy video. In today's video we're looking at the muscle of the abdominal wall, which makes up the third out of 6 layers of the abdominal wall. And the 6 layers are your skin, the superficial fascia, the muscles we're talking about today, then we have the transversalis fascia, then you have extraperitoneal fats, and then the parietal peritoneum. These 6 layers make up the abdominal wall. The first muscle we're looking at is the external oblique. It is a flat muscle with its fibers running inferior medially, meaning hands in pocket direction, and its tendons forms an aponeurosis creating the rectus sheath, and inferiorly it forms the inguinal ligament. Next up is the internal oblique. Also a flat muscle, it lays deep to the external oblique, and its tendon also forms an aponeurosis creating part of the rectus sheath. And from this angle here, we can see how the tendon divides into two, forming part of the posterior and anterior rectus sheath. Again, we have another flat muscle known as the transversus abdominis. It is deep to the internal obliques, and its aponeurosis also forms the rectus sheath, primarily the posterior rectus sheath. But below the arcuate line, it forms only the anterior rectus sheath. That's the reason you can see this gap here. This shows where it stops forming the posterior rectus sheath and starts forming the anterior rectus sheath. Now from this angle you can see the last muscle forming part of the posterior rectus sheath along with the internal oblique, and also all these aponeuroses join together in the middle to form that white line called the linea alba, separating the rectus abdominis. Next up we have the six-pack muscle, anatomically known as the rectus abdominis. It is a muscle most girls are obsessed with, alongside the pectoralis major. It is surrounded by the rectus sheath and divided into two muscle bellies by the linea alba. Last but not least, we have the pyramidalis muscle, which is the small tiny muscle you're seeing here, and it is absent in some people, so it's not that important. Now, these muscles together contribute to trunk flexion and rotation, increasing intra-abdominal pressure and forced expiration. If you found this video helpful, please like and subscribe, and go to the comment section to share more knowledge on this topic. Thank you very much.